Today we're going to talk about piercings. A lot of dermatologists have patients who come to them for piercings that have either become infected or piercings that are causing issues. And while the majority of piercings don't cause issues, when they do, it can be a very significant problem for the individual that is dealing with it. What I usually explain to my patients is that if you do a piercing, be careful to make sure that you do it in an area that won't be a problem if it does become infected. For example, we have a lot of people that have piercings in cartilaginous areas, so areas that have cartilage in them, and if the piercing becomes infected, that cartilage can become infected. It's very difficult to treat an infection of the cartilage, and sometimes it even requires intravenous drugs to treat it, intravenous antibiotics. So I always encourage my patients or people who are considering having piercings to not get piercings in the cartilage areas, because that can be a real problem if it does become infected. Now, how do you get your piercing done is also very important. So, for example, if you get a piercing done and it's done in an area that is easily able to become infected, such as an area where undergarments are covering the area of the piercing, or there's a likelihood of the area getting dirty from exposure to either just plain dirt or other dirty conditions that might be around the area, it's very important to consider avoiding that, because once you get infected in the piercing, it's very difficult to clear it up, and oftentimes the piercing has to be removed. So what I recommend is just avoid areas that are covered or areas that could come in contact with dirt or other dirty environments, and that will be a big help for you. The thing that goes without saying is get your piercings, if possible, done in a clean, reputable place by people who know what they're doing. A lot of times I see people who get piercings done and the area of the piercing is infected almost immediately because they've had it done under non-sterile conditions. Now, we're not expecting people to get piercings done in a hospital. That never would happen. But please remember, the area should be cleaned with alcohol very carefully before any piercing is done. The person who's doing it should be wearing gloves. The person who's doing it should be professional. This should not be somebody who is in an environment where they just learned the other day. And if you have any questions about the person or the environment you're getting the piercing done in, please don't have it done, because it's much easier to have a piercing done in clean and sterile conditions and make it done the right way than to have it done in a dirty or a less than professional environment and have to seek care afterwards to try and fix what was done. Thanks for joining us today, and I hope this was helpful in learning about things that you can do to avoid problems with your piercing.